Welcome back to the program. Now, through the 20 years of marriage, Noel and Nancy Hawks expected to share just about everything for better or worse.
But they never imagined one of those things would be cancer. Last year, Noel was diagnosed with stage 4 non-Hodgkin's lymphoma and Nancy with stage 3C ovarian cancer.
Well, together they battled the onslaught, and today they are in remission. This morning, we welcome cancer survivors Noel and Nancy Hawks, as well as Dr. Chia, medical oncologist from Parkway Cancer Center. Very good morning to all three of you.
Good morning.
Well, Nancy and Noel, if I could just start with you. We just mentioned that both of you are in remission, but this actually happened just about a year and a half ago, not too long ago, is it? So it's so fresh in your mind, the journey that you had to go through. Perhaps you can share with us the background of it.
It all started when we went on a small skiing holiday in Switzerland, and I hurt my thumb, this silly thumb here. And it didn't heal. After coming back to Singapore, after 6 weeks, it was still painful. The doctor in Switzerland had said, don't worry, it's just a small fracture. After 8 weeks, I went for a scan, and they discovered a tumor in my thumb. Once again, the doctor here said, don't worry, 98% is benign, but we'll operate, we'll clean it up, it'll be fine. Unfortunately, it turned out to be stage 4 cancer. Very aggressive cancer. And that's when my cancer journey began. And then a few weeks later, when I was in hospital, Nancy, of course, being diligent, decided she better do a checkup as well. If I'm so healthy and I've never had any problems with my health, she better also go and do a check. And that's when she discovered that she unfortunately had ovarian cancer.
And just a few weeks later from your husband's revelation.
Hardly a month,
That must have been tough.
A real shock to both of you, right? I mean,
I guess
unexpected, I think, especially for me.
Initially, I was totally in denial. Because, this thing shouldn't happen to me. I'm the picture of health. I go to the gym every week. I exercise. I do not smoke. I eat properly. I went for my full medical every year. And in fact, 8 months prior to that, I'd done my full medical, including, Doctor, a colonoscopy and endoscopy.
So, okay, Dr. C, let's bring you in here. Because these two folks here look like they were the most ideal non-candidates for a situation like this. So what happened there? I mean, how is it that they came into this circumstance?
Tell us a bit more about the condition.
Well, at the end of the day, 1 in 3 persons can get cancer, no matter what we do. Certainly, we can raise our risks by smoking and eating the wrong things and never exercising, but we don't completely eliminate our risk. The most important thing is that they found the cancer still at the stage where it can be treated. So that's and they receive all pretty good treatment and they're in remission.
Well, let's talk about Noel's condition first. It was stage 4 non-Hodgkin's lymphoma. Tell us a bit more about that. Are there ways to detect? I mean, when he detected it, obviously he had no signs and it was stage 4. Is there a way to tell?
I think the way that he presented was a little bit unusual. Generally speaking, people do present with lumps and bumps in the neck, in the groin area, anywhere else in the body, and then the lymphoma is staged. It is not really that rare cancer. It is actually in the top 10 of men's cancer. There are 2 types of lymphoma. Generally speaking, it's divided into the aggressive type, which is actually easier to treat than the non-aggressive type, which is slower growing and tends to present at stage 4 at presentation. So between the 2, his is much easier to cure, even at higher stages. So people can present with high fevers, unexplained cough, unexplained weight loss, or that may be related to a lymphoma.
All right, because really, to think here, in your thumb, it wouldn't occur to, for one to say, put 2 and 2 together.
I think his fracture saved him, to be very honest. And the fracture saved him, and he saved her.
That's true, because Nancy, you decided to go for a medical checkup because you were spending so much time at the hospital. You thought, why not? Right? And that's when you discovered it. Maybe, Dr. C, again, you can tell us about Nancy's situation with stage 3.
So ovarian cancer is in the top 10 of women's cancer. In fact, it's in the top 5, and it's getting more and more common. For her, it's been unusual because usually by stage 3 ovarian cancer, patients are presented with bloatedness, a lot of discomfort, where the volume of cancer is great. But for her, the volume of cancer is low, although it is stage 3. It is found at a stage whereby, because the volume is low, it is highly curable.
So, Noel and Nancy, did you both never felt any of the other symptoms described, right? I mean, you felt like you were fine, like things would...
Were you going for your regular yearly medical checkups as well?
I do every year.
Nancy had it, I had it, and we had no symptoms whatsoever. It came like a strike of bolt of lightning out of the blue.
Which is why you earlier said totally in denial. So how did you come to terms with the news?
I guess you're in denial initially, And then you just, reality strikes and you say, oh my God, I could die here. You know, cancer is the kiss of death, most people think. And then you speak with your oncologist and he tells you, look here, no, it's curable. And once you hear those few little words, it's curable, you say, give me the gold standard, bring it on, do whatever is necessary. Right. If it's 6 months of torture with chemotherapy, let's do it, as long as it's curable.
Right.
And then that's when you start the journey with the chemo.
But I want to know what happened in the few weeks, because you were battling with your revelation of how you had to, now face up to the challenge, and then suddenly, when you are the one who has to be comforted, you realize, oh, my wife has it too, and now I need to comfort. How was that like?
I don't know how to describe it. I just could not believe it. When Nancy came out of her operation after 5 hours, I knew something was wrong. And when the doctor told me, unfortunately, she's got cancer as well, I almost collapsed on the spot. I said, there's no way the two of us can have cancer at the same time. And I just kept thinking about my son. He's only 13 years old. Bad enough that one parent could die, but now both of them could go. It was pretty shocking. And I guess then, again, after reality sets in, you say, okay, what can we do to try and resolve this? Is there a way out of this? What can we do to become healthy again? And the great thing was that both of us had it together, and I guess we comforted each other. We went through chemo together. We spent our 20th wedding anniversary in Dr. Ang's clinic, being pumped full of chemo.
So you were really in heart and mind. I mean, really together in this.
Yes.
That was a big plus, actually.
Well, we're very happy to see both of you so jovial, back and full of life. I mean, but Dr. C, again, their circumstances are quite unusual, again, for a couple like that to both be sort of hit at the same time. I mean, but is there any advice for folks who are out there saying, well, we're just like them, we're perfectly fine, normal, healthy, we go for a regular checkup, so what more can we do? Is there more we can do?
Well, I think that there is still some merit in general checkups. General checkups for pap smears for cervical cancer can still detect very early cervical cancer. And colonoscopies are supposed to look for polyps that are maybe pre-malignant. Certainly, blood tests can check out for slower growing low-grade lymphomas, so it is still important to detect it early. Continue to exercise well and continue to eat well. We can really reduce our risk by almost 2 to 3-fold, to say the least. But keep a lookout for signs and symptoms of cancer, unusual coughs, unusual lumps and bumps, unusual changes in the body, unexplained weight loss, unexplained weight gain, or they can still help us try and diagnose any cancers at any stage.
And in the process, when you're in it and you're going through it, I mean, you've seen many patients, Nancy and Noel here, how important is support? How important is the mindset, positive attitude of the patient?
Very, very important. I think the will to live, the love of the family, the love of life, and the fact that something can be done is the key to go.
And also the fact that they were healthy before that, did that help with the recovery also?
Very, very much so. I mean, one of the most important things in cancer treatment is this thing called performance status, which means how well I was before the diagnosis will give us an inclination how well we will be after the end of the treatment. So the better we are at the beginning, the better we will be at the end, and the better that we are to tolerate the treatment.
And having gone through what you've gone through, you look at life differently now. I mean, your bond with your son and everything, the family.
The real cure is do not get stressed. I have a policy now, if I can't influence the outcome, walk away. Do not fight every single battle, because that's just sending your stress level to ridiculous heights, and it's stress what probably brought on my cancer. I'm convinced. Blood boiling. So no more of that.
So that's the word to everyone out there. Don't get stressed.
And thank
the Lord upstairs. A lot of divine intervention in our case.
Okay, be grateful and don't be stressed. Very good advice. Thank you so much for coming in this morning. Very happy to hear your news as well. Noel and Nancy Hawks, they're cancer survivors, as well as Dr. C. Hui T, oncologist from Parkway Cancer Center.
Well, Nancy and Noel's story is one episode in a Channel News Asia documentary series titled Cancer Warriors. It will be aired on the 25th of September at 11:30 p.m. Singapore, Hong Kong time.
Stories like this are always nice because of hope. Anyway, coming up next on AM Live, putting pedal to the metal, find out how you can win a very special experience.
Stay tuned, all the details coming right up.